I want to talk about dry needling. Here at GOfit, we've established a reputation in the area of being effective and safe with this procedure. And we get a lot of our new clients based off of this reputation who are looking to do dry needling from someone with experience. So I want to make this video to just briefly talk about what dry needling is, what it's used for, and why people come and see us for it. So essentially, dry needling is a form of treatment that we use to release trigger points or muscle knots. It can be used for other things, but that is primarily what we use it for, and what most people that are doing the procedure are using it for. So trigger points or muscle knots are essentially just parts of the muscle fiber that have remained in a contracted position. So if we think of the muscle fiber as kind of this long strand, if you break that fiber up into its functional units that are called sarcomeres, inside those sarcomeres are the little myosin and actin pieces that actually link together and contract part of that muscle fiber. Now, when all those sarcomeres work together, we get some action from our muscle, whether that's flexing the elbow or extending the hip. Under low load prolonged contraction or situations where there's a high forceful contraction, or situations where the muscle is kind of overused and it doesn't get enough time to breathe, so to speak, to get new blood flow in the muscle. These are situations where trigger points can form. And if there's enough trigger points or muscle knots in the area, then that can cause weakness, pain, flexibility issues. Most people end up seeing us because it's starting to cause them pain. Very few people come in to see us because they have flexibility issues, although that's usually an adjoining symptom. So people come and see us because they're having muscle pain or myofascial pain. And we use dry needling to reduce those trigger points, essentially by using the needle, which is a thin monofilament needle, much thinner than a needle you would use to get an injection with, and put that directly into the muscle knot. Kind of use the analogy of, I usually tell clients that imagine globally you're flexing a muscle and you're holding that muscle for days or weeks or months or even years at a time. How much tension would be built up in that muscle? Well, if you break that down to a smaller scale, that's what's happening with these muscle knots, with these trigger points. So we take this needle and we put it directly into the muscle knot. And as you can imagine, there's so much tension built up in there that once we put the needle in, it's almost like popping a balloon. You feel what's called a twitch response, and you get this release of that muscle knot. So let me show you what some of these, or the minimal equipment that we need. So here we have, this is how the needle comes in individual sterilized packages. We open this package up to reveal the needle itself. Inside this tube helps us direct the needle into the skin. It also keeps the needle sterile. Once the needle is removed from the tube, it might be hard to see, but this is incredibly thin. It's 0.3 millimeters wide. And done correctly, it can be pretty painless. You don't really get a very needly sensation. If there is any type of needly sensation, then we can take the needle out, change its location by a little bit, and usually take care of that symptom. So that's essentially the most important piece of equipment that we use when we're doing this technique. We also wear gloves to keep things sterile. And of course, all the needles go into a sharps container. Now, a lot of people end up finding us because we've developed this reputation of being effective at this procedure. And we also have people that find us because they've had dry needling before and have had bad experiences with it. Kind of alluded to this a little bit earlier, but there are ways to make this procedure as painless as possible. And as right now, in terms of where we are in medicine, this is the most effective treatment that we have at eliminating muscle knots or trigger points. There are other ways that we can try and go about it, but there's nothing that does this as quickly and effectively as dry needling does to this point. So that's why people want to come and give it another try and see if they have a better experience somewhere else. So that's a little bit about dry needling and how we do it. And I hope this video has answered some of your questions. And if you have any other questions, feel free to contact us.